Welcome back. Let's look at all issues related to COVID-19. The first batch of the AstraZeneca vaccine that South Africa sold to the African Union for distribution has now left the country. 9 countries will benefit from the vaccine. Health Minister Dr Ridhwaan Suliman said in a statement that the balance of the batch will be collected this week to be delivered to 5 other countries that were identified by the AU. Now, soon Easter celebrations will be underway, and health workers are warning that South Africa could face a third wave of COVID-19 infections if everybody lets their guard down. Well, let's look at the latest 24-hour cycle. There were 1,378 new cases, 47 deaths. Now, for a graphical depiction of where we are, we're joined once more by Dr Ridhwaan Suliman, who's a senior researcher at the CSIR. Doctor, it's always a pleasure to have you with us, and thanks for the graphs. Once again, let's start with the average daily cases per week, and if we look at those, it seems that there's no longer a downward trend, but some sort of leveling off.
Good evening, Francis. Indeed, there's certainly a change in the trajectory that we were seeing from the past 2 months. If you look at the number of cases across the country, they were decreasing on a sustained decrease for about 8 weeks. But over the last 2 weeks, there's been a sustained change in trajectory and a slight increase, so a clear change in the gradient of the graphs. Over the last week, the number of new cases that we've reported across the country has been just about 1,200 cases on average per day. It's shown a 2% increase week on week. So while the increase is not drastic and certainly no cause for alarm, it is being driven by localized outbreaks in certain regions. So what is clear is that the virus is still with us, and although COVID fatigue is certainly creeping in, we still have a marathon race to run, and the race is far from over.
And if we move to the provinces, I'm sure you're going to zone in on the Eastern Cape. Is that the one rising? Let's bring up that graph in dark green.
So there's 2 provinces that have shown concerning increases over the past week. The one that you've noted, Eastern Cape, has increased quite significantly compared to a week ago. So it's up 155% compared to a week ago. So while the numbers were generally quite low in the Eastern Cape for a while, the numbers are still low, but it's an increase that's worrying. The other province that is of concern is the Northern Cape, which has shown a sustained increase over the last week or 2, and over the last week increasing by just over 80%. So again, Northern Cape is also it's probably one of the least populous provinces, so the absolute numbers are not quite large, but it's the increase, the percentage increase that's of concern. All of the other provinces generally are leveling off, with a couple of them still decreasing. We just need to monitor any outbreaks and try to get a handle of those.
All right, and I'm sorry, we didn't bring up the third graph, the correct graph there. We were looking at vaccines, but I think you explained it perfectly, that we're seeing this worrying rise in 2 provinces. I mean, does that mean the concerns about a possible third wave, not in the long future, are not unwarranted, Doctor?
Well, we're not really into any third wave just yet. We do need to control any outbreaks, any localized outbreaks, and make sure we identify hotspot regions quickly and efficiently manage those spread further before they rise to national waves. At the moment, we're not a third wave, but the concern is that if it does continue to increase and spread to other provinces, particularly the populous provinces, and possibly triggered by movement and possibly a bit of complacency over the holidays and Easter period, that could trigger a third wave.
All right, now we've got a graph on the screen, so let's move to the average daily virus tests per week. This is testing now. How are we doing in terms of testing?
So the testing has sort of stabilized over the last few weeks. Over the last week, we've been conducting about 26,000 tests per day across the country. And it's sort of been the same for the last 2 to 3 weeks. Remember, based on our testing strategy, the number of tests being conducted is primarily driven by the number of people presenting for testing and showing symptoms. And so this has been quite stable, a slight decrease, 3% week on week. If we look at the breakdown between the types of tests, over the last 3 to 4 weeks, the number of rapid antigen-based tests as a percentage of the total has been between 15 to 20% of the total tests conducted.
Okay, and there's positivity. So let's stay on that graph and talk about the positivity rates. You've always explained that this is crucial because if it's low, it means that cases are being caught, as it were, in the net. If it's high, there could be more COVID-19 out there that we don't know about.
So this is our testing strategy, mainly driven by people presenting for testing. The test positivity rate is quite an important indicator to monitor in the country. At the moment, it's still below 5%. Over the last week, the average is about 4.5%. So it's below that 5% threshold, which is good. It means that there are less undetected cases. The concern, as with what we saw with the cases trajectory, is that after decreasing steadily for over 9 weeks, the test positivity rate has shown also a change in trajectory and a slight increase, a 2% increase week on week. The bigger provinces, the 4 populous provinces, still have test positivity rates below 5%, but some of the other provinces are already starting to show an increase, notably Northern Cape, Mpumalanga, Free State. They're sort of increasing and moving towards the 10% mark.
All right, so again, it's not significant, but you're saying there are these little warning signs starting. Let's move to the situation in hospitals. Last time the situation looked good. Are the admissions still low?
Yes, the hospital occupancy continues to fall as expected because of the lag factor. Across the country, the number of new admissions last week was about 1,700, and that's a 14% decrease week on week. Almost all of the provinces have shown a decrease in new admissions last week, except for the Northern Cape, which showed a slight increase corresponding with the increase in cases that was seen in the Northern Cape.
All right, then please explain, let's bring up the graph relating to deaths, why these could be rising.
Well, we do need to take note that the number of deaths reported here is deaths by reporting date, and I think that's the important point. A couple of days ago, we reported just over 300 new deaths in the country. However, this was because of a backlog of deaths in 3 provinces. 3 provinces did a bit of data administration. These include KwaZulu-Natal, Limpopo, and Northwest. And they reported a number of deaths going back to December 2020. And that's the primary reason for the increase in the number of deaths that are reported this week. It's a 33% increase week on week. But generally, because of the lag factor, we expect that the death trend should decline, and hopefully, if the reporting continues on the day-by-day reporting, we should expect to see that the death numbers should decrease for the next week or two.
And let's pause here. I mean, that means there's a problem with keeping track of deaths as they happen. I mean, it's a bit of a macabre subject, but we really want to get those numbers right, and people talk about deaths being missed, excess death. Do you think we're getting an accurate picture, Doctor?
Well, I think it's important to understand that all of the data has limitations. With all of the trends that are being shown, they are by reporting date. One could look at the trends by specimen date and also by the date of death. However, that data is not easily accessible. It's not accessible for me, so I can't keep a trend on that. So we do have to use what we have. So those are the limitations that we have, and that's why it's important to look at all of the indicators and look at the trend in the indicators. By doing so, we should get an accurate picture of what's going on.
All right, let's move to vaccines, which is so important right now. Last time we chatted, the numbers were going down because of a lack of doses. So we need the vaccine to arrive in the country first. Tell us what you're tracking right now.
So the vaccine rollout still continues to be part of the Johnson & Johnson Phase 3B research implementation study. We haven't quite started a wider national rollout yet. So thus far, we've administered vaccination doses to just over 180,000 healthcare workers as part of the Sisonke Johnson & Johnson research program. The numbers are and still continue to be limited by the number of doses that we have in the country. So if we look, we've been receiving these Johnson & Johnson doses in batches, previously in 80,000 batches. We received just another batch yesterday. So there's a slight decrease over weekends in administering doses, and there's a decrease in terms of when the supply runs out. So that continues to be the bottleneck, the number of doses that we have in the country.
And I think this final graph you sent us is telling. Let's bring that up. An expert, I think, on this show once told us we need to vaccinate, I think, 20,000 a day, at least, if we're looking at reaching the goal of herd immunity by the end of the year. Is that goal of really getting to enough people moving further and further away?
Well, we actually need to administer approximately 200,000 doses a day.
Yes, sorry, 200,000, yes.
So, look, it's going to be continued to be limited by the number of doses that are available. I think that is the main factor that's at play. We do have a number of doses that are on order. Approximately 40 million are in the pipeline. When they will arrive and when they'll start to be administered, I think that's the question. There is a global vaccine shortage. So until we start a wider national rollout, that continues to be the problem. If we can acquire enough doses, I'm sure the speed and the number of doses that we will administer will pick up. I think reaching the threshold of herd immunity by the end of the year is probably a bit too optimistic. So the focus still has to be on the other tools that we have at our disposal in order to still continue to reduce the transmission, and that needs to remain the focus for managing the pandemic.
All right, so we're way off target, but at least some movement, like you say, the Johnson & Johnson, the latest batch arriving. Thank you so much for a very clear graphical picture of where we are. That was Dr. Ridhwaan Suliman from the CSIR. All right, let's take a look at the weather, and we'll